Well, let's get started. And so here's what we're going to do here tonight. Without knowing really what we were going to look like and how many people we'd have, we didn't know how to set this up. But with this small group, I think there's an opportunity for us to have a discussion. So what I'm going to do to start is just do a quick 5 minutes on Missoula Food Bank, just a little snapshot of some of our work and some of our numbers. And then when that's done, I'm going to suggest that we move our chairs into a little circle so that Julia and Courtney and I can help lead a discussion that everyone participates in. If you don't know me, I'm Aaron Brock. I'm the director for Missoula Food Bank. I think I know about everybody here. And I'm just going to touch on a little, just Food Bank 101. So in 2015, more than 18,400 separate different people who call this county home walk through our doors at least one time for food. And we provided a total of almost 120,000 services. And you can see some of the numbers in there, who it is that we're serving in this community. So about 1 out of every 3 people that's getting food from the food bank are kids, 14% are seniors, the same number of veterans, and a lot of folks who have chronic illness or disability. And we talk about emergency food assistance. And for the most part, that really is that's a real description of the service we're providing. 65% of the folks that we saw last year came 3 times or fewer. So you can imagine that family that's on a tight budget, but they're making it, and then there's some sort of emergency. There's some event that happens. The car breaks down, there's a temporary job loss, injury, illness, you name it. They walk through our doors, they get some groceries, but they do dig themselves out of that hole. Darn it, they get their feet back under them. And that's the majority of the folks that we're serving. There certainly are at-risk populations. 20% of the kids growing up here in Missoula County are growing up in households at or below the poverty level. We have a delivery program for homebound seniors. Right now there's about 420 seniors each month that are getting a package of food from the food bank. And then, as I said, folks who are experiencing any number of different crises. Do you have a question, Dorsey?
I do. I was just wondering how your senior delivery program, is that part of Meals on Wheels or different than Meals on Wheels?
It is different from Meals on Wheels.
Okay.
It is a USDA program that we administer, and so it is commodity grocery food that we then have some local donors that help us supplement it, so we have like Ensure and fresh produce in there every single month as well. There are people who might receive both this service and Meals on Wheels, but it's a separate program.
Okay, thank you.
Hi, Ellie. There is, of course, a population of folks who's using the food bank more frequently. You think about our senior neighbors or people with disabilities. If you are on a fixed income and it's not enough to live here in Missoula, visiting the food bank once or twice a month might be just a part of how you survive. But that is the minority statistic of the folks that we're serving. We ask people to come no more than twice per calendar month. For most people, that's more than enough. But second visits did jump by almost 25% in 2015 compared to 2014. So for that small group of people who have more chronic needs, that population seemed to jump last year.
Are you seeing any kind of consistent reasons for those people? Income's down, rent's up, more sickness?
I don't know that we have correlation for this 25% jump. We do know that housing, we ask people when they come in, and we'll talk about this more later, but we do know that housing is the #1 reason that people visit us. Housing cost is cited by folks. We ask people what the reason that most caused them to need the food bank is, and housing is the top of this. we're here because we recognize that this need exists in our community, and that hunger and poverty are a serious issue here in a great place, even in a great place like Missoula, Montana. And the solution to it isn't what we're doing. We think that the food bank is a wonderful place. I'm proud to be a part of that work, but we are not the solution to hunger and poverty issues. And so how do we have conversations that address more directly the root causes, the systemic causes of hunger? And so really that's the genesis for this whole Food for Thought series, is bringing people together in a formative way to see if we can drill down. So the next Food for Thought is Thursday the 21st. It'll be here. We're going to try 4 p.m. at a time, playing with our times. But it'll be in this room, and we'll be talking about childhood hunger specifically. So if you'd like, know that we'll be trying to market that prior to that. So that's the end of my introductory slideshow. The agenda tonight is to bring the 3 groups that have presented the last 3 months back together. And so that's the food bank talking about our service and the trends that we're seeing. That's Julia, who's talking about the Earned Income Tax Credit and its impact on low-income families. And it's Courtney, who's talking about programs that provide insurance to low-income families. And so we can do this. Is it okay with folks if we circle chairs and get together and, yeah, let's do that. So Liz is a Vista at the food bank, and she put together some questions that she could ask us if we wanted that. But I guess before we turn her loose with her list, are there things that any folks want to make sure we talk about in the next 45 minutes?
I can just a quick introduction of why I'm here, and maybe as folks are speaking, they might be able to help us out with that tonight. So we're both from Cedar Mountain Software. Our company makes software for food pantries and Meals on Wheels programs. And we've been finding that as we're working with pantries all over the country, it feels like we have the potential to either, if nothing else, provide tools that help the pantries do things that are the best practices, but also we're trying to learn more about what can food pantries be doing that we could potentially influence by providing tools for them. So we're trying to learn more about, if you can do this right, how would you do it? So we work with pantries, some, the basement in the church, up to the big social service agencies.
And helping them to keep in mind that they're just there they're not going to solve hunger, but that they're aware of it. A lot of the folks that we're talking to are just really sweet, nice people working out of a church that want to feed some hungry folks and are tired of having all these pieces of paper. And they want to be able to have some good reporting, and that's where we come in. So we end up talking to people at a transition period in their food pantry a lot of times. So we're like, oh, we're in a really great place. And we love the way the Missoula Food Bank does it when we look at some of these other places. We're like, oh, we make our software off of a really great food pantry. Because Missoula is such a cool town, I think it's part of it.
So anyway, we're trying to.
It's kind of cool, but we really want to learn more. That's what we want to hear.
Aaron, I know most of the people here, and I think we're mostly the choir in terms of the extent of the problem. To me, hearing you all who are working in it every day talk about bigger solutions would be of most interest. Politically or economically, what do we need to do?
And I would say, Erin, our church, we're from Holy Spirit Episcopal Church, and we're just going through our Missoula Interfaith Collaborative listening process. And so we're just at the end of our collection of interview information, going into discernment in April, and then discussion with the congregation in May. But coupled with that, we have been a food bank supporter and volunteer provider for a long time. But thinking about as we work across the state with our deacons to see where are we best deployed on systemic answers to some of these problems, rather than service is one aspect, but how can we bring education and reflection on some of those issues, and then also where more can we engage that gets at the root of some of these problems that are promoting your existence. Yeah.
I'm happy to weigh in. I wonder if Courtney or Julia want to start, or if you have any initial.
Yeah, to these specific questions.
Sure.
I don't know who was all here last Thursday. I gave a presentation on the federal earned income tax credit. And so I work with an organization in Helena. We're a nonprofit. We do research on tax and budget issues, but one of the things we work on is the federal earned income tax credit. And we're also pushing for a state earned income tax credit. In terms of, I'm trying to get a sense of if I should give a little bit of background in terms of what the federal credit is, and then I can,
Those that couldn't be here.
because I can definitely answer, in terms of your question about like political solutions. I mean, I'm right there. And so just for some background, the federal earned income tax credit, it's a tax credit for low and moderate income families. It was created in the 70s to promote work and to supplement low wages for individuals who are struggling to make ends meet. But it's also to help mitigate the impact that federal income taxes have on low-income communities. So primarily, working families with children receive this. They're earning, married couples earning below $50,000. Some childless workers do receive it, but not as many. The amount that you receive is based on your income, it's based on how many children you have, and it's based on if you're married or not. And so, right now during tax season, this is when people are finding out if they qualify for the credit. They're filing their taxes, they're checking a box, and they're receiving this credit. It's refundable, which means that first and foremost, whatever you qualify for, it goes towards paying off your federal income tax. And then if it exceeds that amount, you get that difference in the form of a refund check. And that's really what is having the anti-poverty impact. I mean, it's grown into one of the most powerful tools to reduce poverty in the country. So like in 2013, 6 million Americans were lifted out of poverty because of this credit. Let's see, I'm trying to think of, there's a lot of things I can say about this.
What kind of magnitude of credit are we talking about?
So it varies on your income and how many children you have, but in 2013, which is like the latest data we have, working families with children received a credit on average about $3,000. Pretty significant, obviously a significant boost in people's income. Most people are using this to cover the basic needs. So they're buying food, they're buying gas, they're making car repairs so they can get to and from work with a reliable form of transportation. They're getting caught up on their bills. It's a pretty significant amount that you can receive.
But that's the amount you receive, the total credit.
It's not the
wipes out
total credit, so that's
your
the
tax credit, your tax liability.
That's the refund. So that $3,000 average, that's the refund that people are receiving. Yeah, that's after it's paid off.
So some of them are getting $6,000 or $7,000, right?
Not that much. The highest credit you can receive is a little over $6,000, but you're never receiving that full amount.
If you have someone who's working and receiving Social Security benefits, do they qualify?
I don't think that they do. Yeah, I'm pretty sure that they don't. I'd have to double check, but I think that's right.
Because some of them are not supposed to have more than $2,000 worth of assets, and if they got $3,000, that would kick them out.
Yeah.
And EITC isn't counted as income when you're trying to get eligibility for things like SNAP or TANF. You know, so it's not going to limit your eligibility for those programs, but I'm pretty sure that if you, you can't receive both in that case.
But they're also not families with children who are the principal recipients.
Families with children are
So
the
your
principal.
senior folks are not.
Yeah,
Or
yeah,
people
so,
with disabilities.
Well, that's true.
yeah, the people that are mostly receiving it are between ages 25 and 64. So,
Are there issues with people who could be receiving it, not receiving it?
yeah, I mean, there's, I said earlier, childless workers can receive it, but many don't. There's a little bit stricter eligibility. So right now, if you're younger than 25, you can't receive the credit. And that has a big impact on people who are just trying to start out and get themselves set
There are
up.
many people who do qualify but don't file.
Oh,
properly or
sorry.
Don't know to check a box.
Yeah. So, yeah, quite a few people actually don't. They qualify and they could claim it, but they don't because they don't know about it. And they don't think even if they do, they don't think they're eligible. So it's something like 1 in 5 individuals who would qualify don't receive it.
So you have to actually ask for it? I mean, generally
No,
the feds just calculate your taxes for you.
When you're filing your taxes, it comes up in some way typically. So if you're a self-preparer and you're doing like TurboTax, when you're working through your forms,
Yes, it'll
pop up.
Yeah.
But it doesn't tell you much about it, and people don't know how impactful this can be, and they don't know how much they will receive sometimes. So self-preparers often don't claim it.
But my question, you have to actually ask for it.
You have to check a box.
Because the
Yeah, you
feds
have to.
calculate my taxes for me every year and tell me whether I did it right or not. So-
Yep, yeah, you have to, yeah.
Okay, That's interesting.
Yeah, there's a
It's a handicap
there's a
right there.
schedule. There's a schedule you have to fill in.
No, no, that seems like that.
I mean, that might be a reason people don't, is because I have to do this other form too.
Yeah.
Of course, you have to have a big enough tax liability to make it of any use to you.
No, you get cash.
It's
I was
refundable.
gonna say, it would, yeah, if you don't have much of a liability,
Yeah.
then you
You
get
get more
more of the,
Oh,
you
more
get
of
This
the.
thing, because that's not what
Yeah,
most
it's a
tax
refund.
credits work.
Right.
Yeah, so this is a refundable tax credit. Some are
Okay.
refundable,
Yeah.
and that's why you're not getting that
Okay.
difference,
Yeah,
Yeah.
okay, that's helpful. Thank you.
And Julie, correct me if I'm wrong, but in Montana, I think it's especially beneficial because we're one of only 1 in 5 states that taxes families in severe poverty. So it's
Yep.
beneficial to take the credit then because it lessens your state income tax burden too.
Yeah, so that brings me to kind of this second point in terms of like what are bigger solutions to addressing poverty in the state, which is something you asked. So we don't have a state credit right now, and 26 states and DC have enacted state credits. They do this typically by creating a state credit that's between 5 or 10% of whatever the federal credit is. And so it would have all the same benefits that the federal credit has. It's going to reduce poverty in Montana. It's going to, 80,000 families are already receiving the federal credit. They would get some more from a state credit. And as Liz was saying, so yes, Montana is it's one of 5 states in the country that imposes income taxes on people living in severe poverty. So if you are a single parent, you have 2 children, and your annual earnings are $9,000, you're living in severe poverty. That's 50% of the poverty line, but you're still paying income taxes. So a state credit would help to, mitigate the effect that has on low-income communities. So that's another reason why we're pushing for a state credit here. So yeah, that's a brief, and there's a lot more to it that I can get into. But
That's interesting, 9,000 with 3 dependents.
2 dependents, yeah.
Well, you
Yeah,
and
you-
2
Sorry,
dependents is
yeah,
3.
yeah.
Still ends up paying income.
Yeah.
That's embarrassing.
It is
When
embarrassing.
So many of us who
Yeah.
have much more money than that don't end up paying income tax.
Yeah, it's a lot. An individual earning less than, I think it's like $4,000, that person's still paying income taxes. So, yeah, pretty bad.
Julie, do you have any numbers on how many Montanans are eligible for the credit? I know you mentioned 80,000 took the credit, but do you have an idea of how many people are eligible?
Yeah, so the last estimates that I saw, it's about a little less than 100,000 people are eligible for this credit.
So a lot of people are taking it if they're eligible.
Yeah.
So this is a bill that's gonna come up this cycle?
It likely will. It's come up in the past couple years. Last year, we had some pretty significant movement on it. Obviously, we didn't pass it, but we had quite a few Republicans in the House Tax Committee vote for it. It went to the House floor and it was killed there, but I mean, that's pretty significant movement.
Yeah.
Moderate Republicans it's a pretty bipartisan issue because we've had it since the 70s. We have so much research in how it's being used and how impactful it is. So both parties are pretty supportive of it. So yeah, it's going to come up likely again in 2017.
And that 80,000, 100,000 number, is that individuals or households or tax filers?
80,000, I'm pretty sure 80,000 individuals. Yeah, 100,000 individuals. Yeah.
And what was when the bill was brought forth, what was the estimated cost?
So the bill that was brought forth in 2015, I'm pretty sure it was a state credit set at 5% of the federal credit. So that was it was $8 million for that.
Okay.
Typically what states are doing when they're trying to enact a state credit, they're paying for a portion of it out of their general funds, but they're also looking for ways to close tax breaks for wealthy individuals and corporations. And so in Montana, and this is something I spoke a little bit about last week, is, for example, we have, in eastern Montana, you have oil companies setting up shop, right? The first 18 months that they're over there working and drilling and pulling out oil, they don't pay any taxes on that production. It's also the most lucrative time in which they're producing. And because we're not taxing them, the state loses out on literally hundreds of millions of dollars in tax revenue. That money, would pay to fix our schools, fix our roads, and it would pay for this program for years down the road. So when we think about how to pay for it, those are the two things we're thinking of. Yeah.
And the oil companies don't pay taxes during that period because it's supposed to be an incentive to get people to come and
Yes.
drill here?
That's the logic, and from the research, that's another issue that I do research on, and I just really, it's not bringing a lot of, it's not an incentive in any way, and it really is hurting our state. So,
I should have, at the beginning of this, asked you to do what you just did, and now maybe ask Courtney to follow suit and just do a quick snapshot of what you talked about so we get a sense of that.
Well, I'm a Vista, like Liz. I'm serving with the Primary Care Association, which is based out of Helena, Montana as well. I live here in Missoula, but I'm back and forth a lot. I'm working on the Cover Montana project, which is a project to help enroll low-income Montanans in health insurance, either through the federal marketplace or through, now that we have Medicaid expansion and the health plan. So my project, I talked about what I've been doing with story collection, which prior to Medicaid expansion, I was interviewing individuals and families about how their lives were affected by inability to access health care. So one of the highlights of the story is a woman up in Kalispell who has needed a kidney transplant, who was unable to get on the kidney transplant list because she didn't have health insurance. And she had lost her job because she couldn't work, so there was no financial way for her to get health insurance. She was going to see the community health clinic, which she could see for no charge, and she wasn't turned away because of her inability to pay, but that wasn't getting her a new kidney. But now that she has Medicaid expansion, she has now gotten on the list. And a lot of what I'm doing right now is working with our network of organizations that are part of the Cover Montana community. So now we have the Missoula Food Bank as part of the Cover Montana community. A lot of the hospitals in the state are the community health centers, and we work with enrollment assisters to get as many people as we can enrolled. So right now we're at 38,000 as of yesterday.
In the Medicaid expansion.
And what is the ultimate goal?
Well, we were supposed to get what's the exact number?
We were projected 23,000 in the first year, and now we're at 38,000.
And there are probably still underserved people out there who haven't signed up yet.
There are still people, we've talked to enrollment assisters, they're booked, like constantly. Usually this time of year, or at least about 2 years ago when there was only marketplace enrollments, like this was their dead time of year, because the open enrollment period has closed, so you can only enroll in the federal marketplace plan if you have a special enrollment period. But now that you can enroll in Medicaid at any time if you're eligible, they see.
In what way does the food bank help?
I'm sorry, what
How
was
does
that?
how does the food bank participate?
Well, so there's been a lot of research by an organization called Enroll America about trusted messengers in the community. And the more people hear about health insurance and the value of health insurance, the more likely they are to enroll. And the food bank is definitely a trusted messenger in the community, and they reach our target population. So in that way, just them mentioning health insurance or just talking about the value of health insurance, giving someone a referral to an enrollment assister, all of those things are extremely helpful.
So is that one of the stop questions on your
Yeah.
check-in thing?
Yeah, we ask folks about a number of different insurance options. Yeah, we have a chip for kids and things like that. And so this is a pretty easy addition for us to make, and a pretty easy referral for us to make.
And we have the great resource of the interviewers that sit down and chat with each person that comes through the shop. And we've employed them before, especially during tax season, to give out some information on the VITA Tax Assistance Program. So with like open enrollment periods and Medicaid expansion, the interviewers are a great resource to just kind of plug that in with everybody that they sit down with and supply more information if they want it.
Are there enrollers on site too?
On site.
Okay. Is that a plan for your new location or no?
We haven't talked about it. Sure. I mean, I think we're open to.
I just don't know if that makes it, kind of where those congregating points are.
I think generically we've always tried to steer people toward insurance, toward whatever feels like a good resource for them, whatever it looks like. And I'll say this relationship is reasonable, and so we haven't done a deep dive on it.
Yeah.
Where are the assisters located?
So there are several at Partnership, the Community Health Center in Missoula. They're at all the community health centers throughout the state. There are some at St. Pat's.
Missoula Aging Services.
That's SHIP, so that's Medicare. We do a lot of referrals, but it's a different program.
Well, and you say that they are really booked. I'm curious, because I have a physician friend who works at Partnership who says that a lot of the patients don't know about it. Is that just because they haven't had a chance, there hasn't been a space they could plug them into? Or?
So Medicaid expansion went through very, very quickly, which
Yeah.
is wonderful for the 38,000 people that have gotten enrolled, but it also meant that DPHHS and Cover Montana, we didn't have time to do like a 6-month campaign period. Like this is all very new. So we're doing as much outreach as we can so people do know about it, and we have been partnering with physicians and practitioners to make sure that their patients know about it. And our enrollment assisters are doing outreach. There's a lot of outreach that's happening in the community, but it's very new.
Thank you.
And a big reason why we invited Courtney to speak was we were looking at some of our data from 2015 and the trends, and 22% of households that came through Missoula Food Bank mentioned that medical cost was a big reason of why they were visiting Missoula Food Bank. So it's certainly something that we see a lot, and like Erin mentioned, housing is the biggest one at the moment, and Erin might be able to speak a little bit more to historically what medical cost used to be.
Without having the numbers from a decade ago at my fingertips, historically, medical cost was the leading cause of people using places like the food bank. And that has shifted in the last 2 years, whether that's ACA or anything else associated with expanded access to medical care and insurance. It's dipped, but still 22% of a substantial number of folks who are citing that. So you'd asked about like what are the solutions, and I don't pretend that I or that we have a silver bullet. I think there's a 30,000-foot view that says it's simply about economics and poverty. If what you earn is below what it costs to live, there's a gap that's been made up somewhere, and some of that is reflected in the numbers that we see. And so does that look like more access to housing that is more affordable? Does it look like higher wage jobs for people on a spectrum of employability and skill level? And the answer to all of those is yes. And then you can drill down and say, how do we move the needle even incrementally? If we could help 20% of folks who are not getting earned income tax credit but would qualify an additional couple $1,000s in federal refund, well, that moves for them. And then are there folks who can get enrolled in some affordable health insurance plan? And does that move the needle? And I think that's, so there's an incremental, there are incremental steps. It seems sort of limitless. Like we could do lots of these things that move.
Well, and on that note, I would also say that like just having health insurance isn't going to cure poverty. It's like it's all of these things working together.
So when you prioritize that, we can't do everything because that is limitless. So if you were to say the 3 things that we want to focus on that will have the greatest impact, what is that?
That's a great question, and I guess I would say the data tells us that housing has to be at the top of that list. And so right now our strategy, which isn't very fleshed out, has been kind of just shine a light on that. And make sure that our friends at Homeward and at Human Resource Council and the mayor's office and so on are aware that that's 52% of the folks that we serve are citing non-affordable housing as being a primary factor for them.
And on that note, in 2015, the average renter mortgage for a family was, or just for anyone that came through, was a little over $500 a month. And then we see some people say that they're making $600 a month and spending $500 on rent. So that's certainly, the data that we get from those intake forms really backs up that if 500 is your average, it's pretty spendy.
Rent anything for $500.
What are you getting for that? But people that visit the food bank, on average, are spending close to 60% of their monthly take-home pay just keeping their roof over their heads.
I would tighten up Dorsey's question a little bit. We're quite a ways from the legislative session at this point, we're a year out, but are there specific things like the tax credit that you are seeing that might be coming along that we could actually actively advocate for? Economic development things, housing builds, what do we go to the city council about?
I don't. At this point, we don't. We're excited that there'd be a state income tax bill that we can plan.
Yeah, I mean, that's a specific thing.
That's a specific thing.
Every MICP center person to write a letter.
Yeah, that's right.
We're kind of expecting a challenge to the current SNAP system. So SNAP is a Supplemental Nutrition Assistance Program, or formerly food stamps. And a couple years ago, I guess the last legislative session maybe, there was a bill challenging the amount of resources that a person could have and trying to count a car that someone drives or the house that they live in against them. So there's an example that I've heard before. Let's say that there's a widow and they live in their own mobile home and have their own car, and they've lost their primary source of income when their spouse passed away, because they have that home and car, they wouldn't necessarily be eligible for SNAP. So we're kind of expecting that to come up again, maybe in some different language. And what you mentioned about advocating, we started a volunteer advocate program in January of this year as a way to sort of really get community members that are interested in addressing these causal issues of hunger, if it looks like a SNAP bill directly or the earned income tax credit or state credit, to get people involved in meetings on that and learning more on that, and having letter writing campaigns and action alerts that go out, calling legislators and that sort of thing.
So when we get a little further down the road, you're gonna have that activated and
Yeah, so we
all
have
signed
the
up.
program right now, but it is so interesting in Montana because we are in a state where we have a legislative session every other year.
Yeah.
We sent out an action alert yesterday or
Yeah,
Tuesday?
yesterday.
It was yesterday, on the proposed House Budget Committee resolution at the federal level. So we're involved in some federal level stuff and some state level stuff, and it's definitely a new program. But that budget resolution is seeking to block grant SNAP, which would make it so once the money's out kind of thing, and it can't be flexible with like events like the recession or other economic crisis or natural disasters. So that's just a little example of what we're doing currently, but it certainly will look really different once we know what's coming up in our state much closer to 2017.
And does that make every SNAP program more vulnerable to state whims and fancies?
In a way, yeah, in some ways, definitely, because states can,
When you're talking
You know,
about
when you're changing the
assets,
funding
I
and
thought
changing
federal
assets,
programs, so there'd be federal guidelines, so that's interesting.
yeah, so there are some federal guidelines, but there are some really interesting ways that states can change the
Yeah.
program in whatever ways they have voted on.
Are you guys connected at all with organizations in Montana that do like housing policy, or even like, I know NeighborWorks is one organization that comes to mind, but even housing authorities and that are providing, housing vouchers to people. Do you guys work with them at all, or?
Yeah, we work with the Housing Authority in Missoula, of the Human Resource Council, which provide the housing vouchers, or at least the majority of the housing vouchers here in Missoula. And I think they're positive, friendly relationships, but it's and I don't think they'd mind me saying it's a really broken system. And it's a 5-year waiting list,
And if you miss a deadline for reapplying, then you get dropped and have to start all over. And some people are under such stress, it's just one more form, they miss it.
And I don't imagine they call and remind you.
No.
If they can find you.
Yeah.
I know a big problem as far as housing goes. So I'm an intern at the Missoula Food Bank, and I'm also in college. So this is towards the end of freshman year, and all my friends are trying to find housing, and it's kind of tough because you're either back in the dorm, or like some kind of university housing, or you have to find like roommates to go and rent, and that's really hard to find, and really expensive, especially if you're a student and you're trying to live on a set amount of money or something. And so I know we were talking about doing like SNAP outreach so more students know about SNAP and everything, but also like just along the housing crisis, there should, in my opinion, there should be more housing for students, not through the university who's trying to make it done, so.
And Liz, again, what you asked too about ways that we're addressing it, like we certainly have some policy views that we're talking over, like what Missoula Food Bank wants to support, like Medicaid expansion was the first policy or bill that Missoula Food Bank officially supported, is that right?
We supported the increase in minimum wage. But I think that's the only other, like the food bank has historically not taken a political stance, and our board has had a shift, really just based on a realization that we can't be a solution, and there have to be solutions that we then become part of.
That's good, because that's a big shift.
Moving in that direction.
A few years ago.
How do you do that with the 501c3 status?
Yeah,
I mean, it's like
we're totally allowed to advocate
Okay.
and lobby. We just can't spend a huge amount of money.
Right.
Yeah, but we're well within our legal rights to do issue advocacy.
Okay.
I think
Well,
it's
you know how
especially
to
if
do
you do,
that.
yeah.
I just wanted
And I think especially if I think about kind of the Episcopalian way of evaluating issues. And I think if you're looking at the pros and the cons, and you're looking at, where is it gonna be funded from? So people are well equipped to then go out and place their votes. So it's not like, go vote for Dave because Dave is about this, but here's the issue, and here's really all about the issue. And if there is resistance to it, what is that? So someone can say, how do I feel about that resistance? Or that makes good sense to me, or it doesn't. So, but I think balanced education, I think, is really important, because if what you come out at is kind of just radical for, with no recognition of why someone would be against it, then there's not that balance, and I think it's harder for people to hear.
A great example of that is this last cycle, we were talking about the school bond levy, just locally here in Missoula. And we had really vibrant discussions, both internally and when people asked us externally. If we had we said, like, yes, will this increase local property taxes for people who are on fixed incomes? It will, and that will hurt people who are already hurting and who are relying on the food bank already. And when we talk about breaking the cycle of poverty, education has to be at the top of that. So both of those things are true. And exactly what you're saying.
But you have to, you have to acknowledge that all of that exists.
I think the food bank could be, this interesting idea of the food bank being part of the housing advocacy. I think that'll be helpful and something to keep an eye on over the next few years. From my time on city council, each year there's a handful of issues that come up that impact housing costs, whether they're zoning changes or individual projects that need to be approved or whatever. Adding the food bank to that list of folks that, and normally it's Homeward and the other housing groups that show up, but I think it would have an impact.
Okay.
Food banks are following those issues and showing up.
Yeah, thanks, Bob.
And probably by letting the people at Homeward know that that's an opportunity, they let you know when it's the time.
Yeah, that's smart.
It's interesting to me that in the last calendar year, there were over 1,000 housing units started or built in Missoula. But it doesn't seem to have had any impact on the availability of lower cost housing. I mean, they're not themselves cheap, but you would have expected some people to move out of the lower cost ones, and that appears to have not happened.
A lot of them are pretty expensive. Like you were
Well,
saying,
I'm saying, you're not
But,
gonna
like-
move, if you're paying $400, you're not gonna move into the courses,
Right.
but people who have been in those units and couldn't move up, there are now places for them to go if their income status is improved, but it hasn't happened.
Yeah, I agree. It doesn't feel like there's an impact there, and I don't know why that doesn't.
Have 1,000 units become occupiable in that time, or are they just?
Yeah, oh yeah, they're all full. You can't find a place to live in Missoula. Well, you can, but it's not.
We've talked a bit about like some sort of SNAP legislation we have coming up and state income tax credit, tax credit. Courtney, do you expect any legislation about Medicare, Medicaid, expanded Medicaid to come up in the next session either?
There, yesterday was one of the HELP Act Oversight Committee meetings, and a member of the board has already stated that they are going to issue a bill that would try to repeal Medicaid. So it is a fight we're getting ready for. That's a lot of what the work I'm doing is working on story collections to see how people's lives are being affected, especially in these counties and districts where these representatives are coming from. But yes, it's going to be an interesting legislative session to say
It's
the
hard to
least.
get past the first time, I don't know.
So they're saying repeal in 2017, but it does sunset,
It sunsets,
right, in
yes.
4 years.
Yes, it sunsets in 4 years
Yeah.
either way. Yeah. So either way, it's something that we will have to fight for, but we'll probably have to fight for it sooner than we thought.
And what do you think some of the, I could think of maybe, what do you think the negative impacts would be of expanding Medicaid officially in January of 2016 and then repealing it a year later? What sort of impacts do you think that would
be
have?
disastrous.
Yeah.
I mean, you would be taking health care away from 40,000 people, almost 40,000 people. At this point, who knows, it's probably going to be quite a bit more by 2017. and taking away health access from people who just got it, it's going to take not only just the immediate healthcare ramifications and poverty ramifications, but it's going to take people's faith away from the system, even more than they already might be.
Well, plus the healthcare system has adjusted to having those clients in it now.
Yes.
And if you suddenly take them away, that's a big economic impact.
To providers.
Yeah.
Well, it was your organization that projected 12,000 increased jobs because of Medicaid
Yeah.
expansion, and if you take that away.
And some of those are pretty good paying jobs.
Those are all
so you don't
moderate to
wanna-
high paying jobs.
Yes, people
Yes.
that buy books and.
I just don't know how to get this information to the people who, I mean, like we're the choir, as you
Yeah.
said earlier. And the people who are just angry. They're just so angry they're not gonna hear a bit of sense about any of this. And that's the piece that seems to me like the long-term solution, is to calm down the angry people and get them to, like, shift their perspective a little bit. That's the hard part.
Who do you mean by angry people?
People that love folks like Trump and who are electing people to office who are gonna kill Medicaid expansion after it's been out there for 1 year. Not even. You know,
Well,
they're
I
out,
was-
it's like a couple of months and they're already trying to kill it.
And it's already saved $3 billion to the state.
Right.
Yeah.
I think the
Yeah.
things like what you're describing.
Morgan Heights, please come to the accounts desk. Morgan Heights, please come to the accounts desk.
So helping them understand the cost savings and this thing about the economics of the oil industry, they're not going to be hindered by paying, how much would they be paying? Like how much would they, like those kind of numbers, you gotta get those to people. It's just,
And I think, Courtney, you do a lot of storytelling
Yeah.
and collection for that purpose. Do you want to explain a little more about that?
A lot of it is just appealing to, these are my neighbors and this is how their lives are affected. I think the biggest challenge that I've run into is even people, this is how their lives have been affected. They're told one thing like, oh, it's because of your taxes and your government doesn't care about you. So kind of adjusting that mentality and getting them involved with the political process. It's not a stance of the Primary Care Association, but just from taking that hat off, is getting people involved in electing their public officials based on their needs and just talking to them about what solutions to the problems are in a not polarizing way, which is very difficult right now, but.
Does the food bank do voter registration?
During election season, we don't do it ourselves, but we'll have like a table where Montana Women Vote, for example, will come and table our stuff.
You got like Montford and stuff do that too? Or?
Yeah. Whoever wants to.
Yeah.
And that's a big aim of the food bank's advocacy program too, is to collect more stories from people who have used the food bank services and can provide the perspective of how medical costs influence or need to use the food bank, or high housing costs. So we can take these stories and try to appeal to what Courtney said is like your neighbor, or like someone that you know, someone you see on the street that looks just like you but is going through this experience, to try to appeal to that more personal side of politics, which is sometimes the last on the list. Like the budget is a huge deal, obviously, but using that storytelling and creative advocacy to maybe try to flip the script on some of those things too.
And to your point about, how do you turn that tide? I'm with Missoula Aging Services, and I'm here because we want to collaborate with the food bank. And I think a lot more organizations are realizing the importance of advocacy and really getting the message out there. We've done, a smattering of things in the past, but we're really trying to get more focused. Voter registration is probably going to be a big push. We're lucky we have same-day registration in Montana, so that helps quite a bit. But yeah, we're just more and more realizing that we have to start working across silos and just get the data and the stories and the information. Yeah, they already mentioned Congress's, the House committee that looks at SNAP is proposing a I think it was like $10 billion cut over the next 10 years. And
that
you know,
includes Medicare and Medicaid cuts too.
Right.
Yeah. Additional funding.
So yeah, it's just, you know, it's so immediate now that we really have to ramp up.
And that's a great example, because politically, Medicare has this huge population of folks who vote. And Medicaid does not. And if anything gets cut, they Medicaid.
Now, go ahead.
Well, I was
Sorry,
just
go
gonna
ahead.
say, I think, like, my organization is primarily a research organization. We haven't been doing a lot of, like, field work and collecting stories and learning about how, like, what does it look like to be a Montanan and receive the earned income tax credit? Like, I can tell you data points about how many people are receiving it and how much that brings into our economies, but when we go to the legislature and have those conversations, they want to know, like, they want to know the stories. And so in the past, we haven't had those stories, and now this year we're really working hard to gather that. So, like, I'm working with VITA sites across the state that do free tax preparation services, trying to learn about, like, how are people actually using the refunds here in Montana. I know at the national level that people are using this to buy groceries, you know, and what I said earlier, but I know that's happening here in Montana, but, like, I need to have those stories to tell legislators. So I mean, I would like to work with the food bank and gather some, you know, stories from individuals that are using their guys' services, and how the earned income tax credit either helps them, you know, purchase food and not have to use the food bank as much. But, you know, and in the faith community, are there people, you know, how is that affecting everyone? You know, I'm even thinking about going to, like, auto repair shops and asking people, you know, because I'm sure there's an influx in services. You know, people are making car repairs when the refunds come in. So, yeah. Or, like, at the beginning of the story collection thing.
Of course, even better when you go to the legislatures to take those people with you.
Right, and we have.
They testify better than you do.
Yeah, definitely. They're very.
That's what happened with Medicaid expansion.
Yeah, and we did last year. We had a couple individuals in the room who had really powerful stories, but yeah, we need so many more.
So there's a lot of the discussion is on how to increase benefits levels and stuff, and Max mentioned. But I'm kind of curious on the other side of it, like on the income side, whether there's data from the food bank, or what the insight is on that side about, you know, people are making $600 a month, paying $500, how do you get them to make more, rather than, you know, how do you up that side of it? And is there a role, there seems like a real natural role for the support agencies to play in trying to increase the benefit side, you know, the subsidies and so on, but is there a role for the support agencies to play in on the
Living
economic
wage
side?
legislation.
Does anyone know what, like, a living wage would be here in Montana?
Depends on who does the research, but somewhere in, like, it's a lot more than the actual minimum wage.
Right, 'cause
In the
that's
13 to,
805, right?
13 to 15, I think.
Bob Oakes used to have some pretty good statistics on that.
And with your point with the income at the food bank, the average monthly income of people that come through the doors, not counting people who report that they have zero income per month, is $932. And that's just, it's not like per person or per household, that's an average across the board for everyone that we see.
Per household.
Per household, excuse me, yeah, per
So it might be a
household.
single family, a single mother, or it might be
That might be a-
10 people.
Yeah, might be just one person.
How about the number of families with one person versus two people working? Do we collect that data?
We
need
collected,
to
but
work
we
with Bob
haven't
and get more
teased it out,
sophisticated on
yeah.
that.
Yeah, it's a hard one,
Programs
because
do that.
people are married and they're not married. I mean, it's hard to find out.
Yeah, I think our question is, like, is somebody in the household employed?
And then it has like what's income per month per
Right.
family or per household, yeah. So the data's there, we would just have to
Tweak it better.
tweak it, yeah, definitely.
I don't wonder, so minimum wage legislation, what else?
That's what, yeah, that's at least the place to start.
Well, we're kind of, I think, lucky as a state too. that we don't have sales tax and everything like that. Some places do, but I wonder what other taxes similar to that are in place here that might increase the cost of living.
I will
And
say,
effective business incentives, that, you know, we talked about some that may not, they have mixed reviews, but what creates more economic engines in the state.
and I think, you know, there's a part of me too that says it's so important to do it right and responsibly. And
Yeah,
like,
exactly.
there are lots of examples of high-paying jobs that, or high-paying industries that I hope don't come to Missoula. And so
Yeah.
it's but it's hard to be picky too.
Right, right.
I will say, I just want to add on, we started looking back at some of our historical data after Julia's presentation. We just went back like 4 or 5 years, but there is a dip. Our January numbers are historically always about 20% higher than our February numbers. February dips, March dips, and then April jumps back up to where it had been. And really, I mean, the whole trend looks like this, but in relative terms, and it feels like that's earned income tax credit. And like, we don't have another hypothesis for what would cause.
There's some reason.
There's some reason, and that's the time of year that people would be getting.
Because with our screwy tax system, a lot of people get a refund even without the earned income, because you get taxed as you make it, even if you're not gonna owe any taxes at all.
I think it's, well, after 6, if anyone has any last remarks, or we can hang out. I'm not sure if anyone else has this room reserved afterwards. I've seen a few people wander in and look a little bewildered, so they might, but I'll be here, and if you guys want either these two contact information or Aaron's, it's on that table. Or business
Thank you.
card.
Very good.
Thank you guys for coming, yeah.